In this video, we will discuss definitions of chronic kidney disease, stages of chronic kidney disease, calculation of glomerular filtration rate, etiologies of CKD, and pathogenesis of chronic kidney disease is defined as kidney damage is for more than 3 months. The damage is proven either by biochemical test like deranged RFTs. In RFTs, usually we do creatinine and blood urea nitrogen, or radiological tests like kidney scans and or histological tests like biopsy. The second definition of chronic kidney disease is documented glomerular filtration rate is less than 60 milliliter per minute per 1.73 meter square for 3 months. Please note normal GFR value is 90 to 120. Now we will discuss the stages of chronic kidney disease. With the help of glomerular filtration rate GFR, we divide CKD into 5 stages. According to GFR, stage 1 is when the GFR value is greater than 90 milliliter per minute per 1.73 meter square. According to GFR, when the GFR value is 60 to 89, this will be stage 2. In stage 3, the GFR value will be 30 to 59. In stage 4, the GFR value will be 15 to 29. In stage 5, the GFR value will be less than 15 ml per minute per 1.73 meter square. In this stage, patient usually needs dialysis and transplant. Now, how we will calculate glomerular filtration rate GFR? Now here is formula for calculation of GFR. GFR is equal to 0.43 multiplied by height in centimeter of the patient divided by serum creatinine of the patient. Here is other alternate ways to calculate GFR as well, like inulin clearance test. This is gold standard test and most commonly used in practice test is DTPA test. This slide is about the pathogenesis of CKD. How CKD developed in a patient. There are possible pathogenesis like hyperfiltration. Some nephrons are lost during kidney damage, but the surviving nephron undergoes hypertrophy of glomeruli due to increased hydrostatic pressure and increased protein passage. As you know, proteinuria is toxic. Proteinuria causes kidney damage by direct cytotoxic effect. The third possible pathogenesis is hypertension. How hypertension causes CKD? It causes CKD through hyperfiltration injury. The fourth possible pathogenesis is hyperphosphatemia. It causes kidney injury due to calcium phosphate deposition in renal interstitium. The fifth possible pathogenesis in CKD development is hyperlipidemia, as hyperlipidemia causes accident-mediated injury to the kidney. This slide is about the possible etiologies of the chronic kidney disease. There are multiple causes of chronic kidney disease, but I have divided this according to the age of the patient. Like in patient less than 5 years of age, the possible etiologies are: this age is according to the age of onset of kidney damage. In less than 5 years of age, the possible etiologies are congenital malformation of the kidney like kidney hypoplasia, dysplasia, horseshoe-shaped kidney, and polycystic kidney. The second possible etiologies are obstructive uropathies like in patient In posterior urethral wall or PUJ obstruction, the patient usually develops CKD. The third possible etiology is neurogenic bladder. This neurogenic bladder is usually present in hydrocephalus or in patient top neural tube defect. The fourth possible etiology is renal vein thrombosis, and the fifth one is HUS, hemolytic uremic syndrome. In patient of more than 5 years of age at which the kidney damage starts, the possible etiologies of CKD are focal segmental glomerulosclerosis, membranoproliferative glomerulonephritis, rapidly progressive glomerulonephritis. In these three, at the disease onset, usually the patient is well thriving. The other possible etiologies of CKD in patient of more than 5 years of age are renal calculi, Alport syndrome, SLE, cystinosis, and drugs, etc. In